My name is Dr. Jenny Zablah. I'm a congenital interventional cardiologist and director of the Pulmonary Vein Stenosis Program at Children's Hospital, Colorado. In our program, a dedicated team collaborates to support patients with pulmonary vein stenosis. This is also known as PVS. Beyond performing life-saving procedures, we prioritize their overall growth, mental health, and quality of life, ensuring comprehensive care every step of the way. We have recently gathered data on the management outcomes of patients with PVS at our center over the past 23 years. Congenital pulmonary vein stenosis is a rare heart condition occurring in about 1 to 3% of children with congenital heart defects, where the veins that carry blood from the lungs to the heart are narrowed, affecting oxygen flow and pressures in the heart. Early diagnosis and treatment are crucial to manage symptoms and improve the child's quality of life. Over our center's 23-year experience, we categorize patients into two cohorts, those treated before and after 2017. This milestone year marks the launch of our PVS program, signaling a shift toward more comprehensive medical management and interdisciplinary teamwork. The study includes 224 patients, with the majority of them having a catheter-based intervention as the primary approach after diagnosis. Most patients had PVS related to being born premature. Also, we identified that bilateral disease, which means that the left and right side of veins are involved, was found in almost 30% of our patients. Our patients have demonstrated an overall better survival rate than the national average. Following the establishment of our PVS program, the one-year patient survival rate increased from 80 to 93%, and the 5-year survival rate improved from 77 to 84%. During this study period, 62% of mortalities were due to other comorbidities. To improve even further our outcomes, ongoing research to understand the disease and enhance diagnostic and treatment options is critical for improving the patient survival. One example of such advancement is optical coherence tomography, or OCT. Originally developed for coronary arteries, this imaging technique is being utilized by our center for the first time in the U.S. to understand and manage pulmonary vein stenosis. It has become part of our standard of care, enabling us to streamline procedures and reduce procedural times and radiation doses during the cardiac catheterization. OCT also helps predict potential disease progression that is not yet visible on angiography. One of our publications shows how disease progression occurred when medical management was altered and how the pulmonary vein wall thickness normalized with the reinitiation of medication, effectively rescuing that vessel that had nearly disappeared. Understanding the causes of PVS would enable us to detect it sooner, treat it earlier, and potentially prevent it altogether. At the moment, we're investigating blood biomarkers in PVS patients, aiming to pinpoint potential treatment targets or diagnostic indicators for the disease. Additionally, we're actively engaged in the PVS network, a nationwide initiative unifying PVS programs with the common objective of enhancing patient survival. Within this network, we're gathering DNA samples to uncover genetic variations that could shed light on disease origins, risk assessment, or potential treatment avenues. Patients identified with pulmonary vein stenosis necessitate a thorough evaluation encompassing an assessment of their quality of life and recognizing that both physical and mental well-being are equally significant. This evaluation ensures a holistic approach to their care. This evaluation includes various aspects such as physical health, emotional well-being, social interactions, and overall satisfaction with daily activities of the patients and the families. Understanding the impact of the condition or their quality of life helps tailor treatment plans and support services to address their unique needs, ultimately aiming to improve their overall well-being and resilience in coping with the challenges posed by pulmonary vein stenosis. Finally, but certainly not less crucial, screening tools play a pivotal role in identifying disease, progression, or the need of intervention, facilitating timely actions. In partnership with Dr. Jennifer Mueller from Colorado State University, we've explored the application of electric impedance tomography to assess lung perfusion and ventilation non-invasively, eliminating the requirement for radiation or contrast. This method enables the evaluation of blood flow redistribution caused by the progression of the pulmonary vein stenosis. When combined with echocardiography, it aids in determining the optimal timing for intervention, thereby preventing the loss of lung segments due to this condition. As demonstrated throughout this video, managing patients with PVS entails navigating complexities. To ensure comprehensive care, we convene a monthly clinical PVS meeting at Children's Hospital Colorado, where patient cases are reviewed and individualized plans are formulated. Additionally, we host a quarterly parent support group to educate parents about PVS, foster social connections among families facing similar challenges, and cultivate a sense of community. Lastly, patients benefit from early referral to our neurodevelopmental clinic, facilitating timely intervention and setting the stage for improved medium-term outcomes. For more information about our program and how to reach us, you can scan this QR code. Thanks for listening.